Hello, everyone. Tonight we're going to be talking about integrated healthcare for youth. So, when thinking about integrated healthcare and approaches for youth, integrated healthcare is an essential for addressing the overlapping physical, mental, and social health needs of children and teens, fostering a holistic care that improves overall well being and outcomes. According to the video that we watched for this week's module, they talked about how integrated healthcare is a way of doing care and business. It's also a way of delivering care to families. So, integrated healthcare began in pediatrics and has evolved over time. So, some key topics when talking about integrated healthcare for children and teens is integration, so coordinated care across services, disparities, which is addressing inequalities in health, practice, implementing holistic care models, and goals, improving outcomes for youth. So when you're looking at an integrated healthcare organization, these are going to be their main focuses when they're working with the populations that they serve. The definitions and scope of an integrated healthcare system is integrated healthcare for children and teens evolve coordinated physical, behavioral, and social services promoting comprehensive support for youth facing complex health challenges and enhancing overall well-being. Integrated healthcare for children and teens seeks to coordinate health, physical health, behavioral health, and often other supports in a unified delivery system rather than fragmented silos. This is especially relevant for young people because many health issues such as chronic illness, mental health, and substance use first appear in adolescence and are often cut across care settings. For example, there is a model that we'll talk about later on in this slideshow about integrated care for kids model that targets children under 21, focusing on both behavioral and physical health. So, when we're talking about definitions, we're talking about coordinated services of delivery model. The scope is focusing on youth health needs, model integrated healthcare for kids initiative, and an emphasis on evolution from pediatrics to integration. So, when we're talking about importance of addressing these issues in a social work practice, the youth in our communities have complex needs that need to be addressed by our healthcare systems. There are systems that adults are not part of, such as foster care system and school systems. Integrated healthcare practices refers to the operationalization of integration, how health systems, practice, clinicians, and organizations collaborate to deliver integrated services. It's the how of making integration happen. Some principles such as multidisciplinary teams, such as primary care and behavioral health, shared care plans and co-location, or close collaboration, data exchange, care coordination, and patient-family engagement, addressing social context. So some key components of integrated healthcare is just serving the whole child. So, a coordinated model linked physical, behavioral, and social health services to treat the whole child. So, when we're talking about the key components of an integrated healthcare for youth, we're talking about collaboration across primary care, mental health, schools, and community settings, family centered and culturally responsive care, shared data systems and care plans, and focus on prevention and early interventions. The key benefits of integrated healthcare for children and adolescents is improved access to care and early detection of mental health or physical issues, better management of chronic conditions, reduced fragmentation and duplication of services, enhanced family satisfaction, and overall health outcomes. Some examples of successful integrated health programs are there are some integrated healthcare models, so integrated care for kids model, CMS initiative that's uniting health, education, and social sectors for children that are under 21. There's school-based health centers that combine primary care, behavioral health, and nutrition counseling for accessible youth care. And then Children's Hospital of Pittsburgh, adolescent and young adult medicine integrates behavioral health and physical health with one clinic. There's also an initiative that is opening up community behavioral health clinics, CCBHC. So those are focusing on that integrated healthcare and really focusing on the whole person and supporting them throughout their lifespan. So they really put a heavy emphasis on that care coordination and wraparound support with not only mental health but physical health as well. So here are some case studies that we talked about. So that integrated model for holistic care, schools, um, when you're wanting to get to those kiddos and address those kiddos, getting in the schools is often the first place to start, especially for those marginalized kiddos or those who are hard to reach. Children's youth focused health service integration and outcomes positive impact on health access. Next, we're going to talk about health disparities for youth. So, children and teens health disparities arise from preventable differences in health outcomes driven by factors such as poverty, discrimination, and lack of access to quality care and education. So, preventable differences in health outcomes among groups defined by race, socioeconomic status, or geography. Some contributing factors of health disparities is poverty and limited access to health care, racial and ethnic discrimination, rural or underserved community location, and educational inequities and lack of insurance. So these are just a few of the health disparities that children face. So what are some implementation strategies? So creating an interdisciplinary team is one strategy. Um, So, an effective integrated care required building interdisciplinary teams, utilizing shared electronic health records, and embedded behavioral health within primary care to address complex youth needs holistically. So, let's think about that and what that would look like. So, that would be sharing electronic records and care coordination systems, embedded behavioral health within primary care or schools, just like we talked about before, that wraparound care for these kiddos. So, interdisciplinary teams, physicians, therapists, and social workers all working together to kind of bridge those gaps. So, this goes into a little further, just like what we just talked about, that coordination, EHR systems, uh, and just kind of working with that primary care. So, where do social workers come into this? So, the role of a social worker is addressing those complex needs of youth challenges, engaging and facilitating family involvement in care, advocating and promoting social determinants awareness, and then action. It's our job as social workers to call to action and innovate care models. um, we're just a bridge for those families, schools, and health systems addressing social determinants of health. So, those housing, food insecurity, and transportation, and advocating for culturally competent, trauma informed practices. So, some challenges and barriers and solutions in integrated health practice. So, some barriers are funding gaps, limited training, privacy regulations. Some solutions are value based payment models, workforce development, and integrated policy. That's just some of. So, just a little recap: integrated healthcare coordinates physical and mental health services to meet children's holistic needs. Importance: reduces health disparities and improves long term well being for youth. And a call to action: social work students should champion interdisciplinary collaboration, advocate for equity, and empower families to access integrated services. So, just a little bit more about the social worker's role in advocating and integrating care for youth. These are my references. One of them should be the link to the video and the PDF from this week's module, and then some other sources. So, a question for you would be: how can integrated healthcare models help reduce health disparities among children and adolescents, particularly in underserved or marginalized communities? I look forward to hearing from you.